So good morning. Thank you, Dr. Subudhi and Dr. Natarajan, for giving me this opportunity. I shall be speaking about the government guidelines in telemedicine. So as Dr. Subudhi has already introduced the topic, that it leads to timely access to appropriate optimal interventions, faster access to services that may not be otherwise available, and the financial costs associated with travel would be reduced with telemedicine. So they can particularly play an important role, especially for regular routine checkups or continuous monitoring, if not the original consultation. And it can certainly reduce the burden on secondary hospitals. With telemedicine, maintenance of records and documentation is inherent, and written documentation increases the legal protection for both the patient and the practitioner. So all these guidelines, all these regulations were existing, and these acts primarily govern the practice of medicine and information technology, but gray areas and gaps in legislation and the uncertainty of rules posed a risk for both the doctors and the patients. So COVID-19 precipitated a crisis, and the positive outcome of that is basically telemedicine. It had an adverse impact on the quality and the standard of healthcare, and to address this need in the wake of COVID-19 outbreak, the government legalized the mainstreaming telemedicine in health systems to minimize inequity and barriers to access. So by a public notice, MCI 211 of 2019, they incorporated an amendment in the Indian Medical Council Act titled as Consultation by Telemedicine in the said regulations. The telemedicine practice guidelines were issued as Appendix 5. So they defined telemedicine as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communications technologies for the exchange of valid information for diagnosis, treatment and prevention of disease and injuries, research and evaluation, and the continuing education of healthcare workers with the aim of advancing the health of individuals and communities. The definition of registered medical practitioner was defined by this act as is defined as a person who is enrolled in the state medical register or the Indian medical register under the IMC Act. There is a difference between the definition of telehealth and telemedicine. Telehealth is defined as the delivery and facilitation of health and health-related services, including medical care, provider and patient education, health information services, and self-care via telecommunications and digital communication technologies. In general, telemedicine is used to denote clinical service delivered by a RMP, while telehealth is a broader term of use of technology for health and health-related services, including telemedicine. So, the registered medical practitioners are entitled to private telemedicine. All of them will take an online course in practice of telemedicine. This was the original plan of the government, but now since we have reverted back to the physical mode of practice, this telemedicine course is yet to be introduced and yet to become binding on the RMPs. To enable all those RMPs who would want to practice telemedicine get familiar with these guidelines as well as the process of limitations of telemedicine practice, this online course was to be developed. Now I am using the replacing the word will to be developed, was to be developed, and it is yet not done. So the guidelines of telemedicine basically involve the professional judgment of an RMP should be guiding principle for all telemedicine consultations. An RMP is well positioned to decide whether their technology-based consultation is sufficient or an in-person review is needed. No compromise on quality of care. Tomorrow if something happens, you are equally held negligent for physical consultation as also telemedicine. So we need to take all kind of precautions. So basically telemedicine involves 7 elements need to be considered before beginning any telemedicine consultation. What are these 7 elements? The context of consultation, identification of RMP and patient, mode of communication, consent, type of consultation, patient evaluation, and then patient management. So What is the context? The RMP should exercise their professional judgment to decide whether a telemedicine consultation is appropriate in a given situation or an in-person consultation. They should take a clear call. They should consider the mode technologies available and their adequacy for a diagnosis. The RMP shall uphold the same standard of care as in-person consultation, but within the intrinsic limits of telemedicine. The identification of a patient, if the patient is present in person, this thing, but for telemedicine, the RMP should verify and confirm the patient's identity by name, age, address, email ID or phone number or registered ID as appropriate. Where the patient is a minor, after confirming the age, teleconsultation is allowed only if the minor is consulting in the presence of an identified adult. And every RMP shall display the registration number on the prescription website as we do for physical consultation. The mode of communication. Multiple technologies can be used to deliver telemedicine consultations. Primarily, there are three modes: video, audio, or text, that is chat, images, messaging. There may be situations where in order to reach a diagnosis and to understand the context better, a real-time consultation may be preferable over an asynchronous exchange of information. The consent. The patient consent is necessary for any telemedicine consultation. The consent can be implied or explicit. What does it mean? If the patient initiates the telemedicine consultation, then the consent is implied. Explicit patient consent is needed if a health worker or an RMP or a caregiver initiates the telemedicine consultation, and then that is referred to the RMP. The patient information. The RMPs must gather sufficient information before making any professional judgment. An RMP would use his or her professional discretion to gather the type of extent of information. This information can be supplemented through conversation with the healthcare worker, provider, or by any information supported by technology-based tools. If an RMP feels that the information received is inadequate, then he can request for additional information in real time or shared later via email or text as per the nature of such information. For example, an RMP may advise some laboratory and or radiological tests to the patients, and that reports can be shared in the asynchronous methods. The telemedicine has its own set of limitations. The RMP should not proceed until a physical examination can be arranged through an in-person consult, examination by another RMP or health worker, or in-person consultation. The information required may vary from one RMP to another based on his or her professional experience and discretion, and for different medical conditions based on the defined clinical standards and standard treatment guidelines. Then the first consultation and follow-up consultations, what are the guidelines? The first consult should preferably be via video for better judgment and better advice. If the patient is seen in person earlier by the RMP, then it is possible to be more comprehensive in managing the patient. The first consult means the patient is consulting with the RMP for the first time, or if the patient has consulted with the RMP earlier, but over 6 months' time has elapsed and the patient has consulted with the RMP earlier, but for a different health condition. In these three situations, it is considered as a first consult. Then the follow-up consults are further defined due to the paucity of time. I would like to proceed further. The patient management is important. The counseling can be done on how the prescription of the medicine should be taken up. While prescribing medicines without an appropriate diagnosis and provisional diagnosis will amount to professional misconduct. So before you prescribe any medicine, the diagnosis is most important, and prescribing limitations have specific restrictions on limitations on prescribing medicines. The medicines are classified as O, A, and B list. What is O list? Is something like an over-the-counter medications which can be used for common things like, for instance, paracetamol, ORS solutions, cough lozenges, etc. What is list A? These are the medicines which can be prescribed through the first consult, or which is a video consultation, and subsequently they can be added to the initial consultation. What is list B? List B is a list of medication where RMP can prescribe in a patient who is undergoing follow-up consultation, in addition to those which have been prescribed during the in-person consult for the same medical consultation. And a prohibited list, if RMP provided in consultation where telemedicine cannot provide the prohibited list. So these are the lists O, A and B prohibited, and these are the matrix which decides what kind of medication can be prescribed through telemedicine. Issue a prescription with all your letterhead, with the registration number, with all the required criteria. RMP should provide a photo scan, digital copy of this signed prescription, and the patient, this data has to be maintained by the RMP for future use. Thank you very much for your patient hearing.